Hi Fosters, it's Kayla here. I'm at Countryside this morning and I'm speaking with Dr. Johnson here. We're going to answer a few questions about mange because I know that's one of the number one topics that I hear from fosters about. We have mangy dogs coming from the rural areas. Can I get it? I don't know if I'm comfortable bringing it in my house. What kind do they have? So I'm just here to get a few questions answered and hopefully ease your minds about the concerns you might have regarding mange. So, first question I had for Dr. Johnson here was, what are the two kinds of mange and how do they differ?
So the two different types of mange that you're primarily going to be concerned with, these dogs that come into rescue situations, are going to be ones from either the demodectic mange or the sarcoptic mange. Demodex is the Demodex type. Now, Demodex is one that a lot of puppies incur. It usually gets passed from the mom to the puppies when they're kind of early at age, about a week old, mostly because the Demodex is a type of mite that's carried on pretty much all dogs. The Demodex start to flourish when the immune system is a little bit suppressed, which is pretty common when dogs are pregnant. Just like in people, immune systems when people or dogs are pregnant, just gets a little bit quieted down. And this allows the Demodex to really flourish and then can spread to the puppies. So typically the Demodex isn't something that, it's probably the most common type that we see, but it's not usually one that we get too serious about real serious health concerns. Usually as the immune system continues to grow and mature and become stronger, it can then control these Demodex mites. But it still doesn't mean that we don't try our best to try to limit the amount of Demodex that kind of occurs in these dogs. And so we still try to proceed with the different treatment options available. Now, the other type, the sarcoptic mange, it's commonly known as scabies. There's going to be those ones that you really hear about, it can affect wildlife, it can affect a lot of stray dogs commonly. This is going to be the one that causes dogs to be really extremely itchy. And that's primarily because this type of mite, rather than the Demodex, which focuses on the hair follicle, the scabies mite really burrows into the skin, laying eggs as it goes along. And so this is really irritating to the skin. Now this type of mite is really difficult to diagnose because when dogs come down with these types of changes, they're going to only have a very few amount of the scabies mite present on them. And so it makes it so that skin scrapings or a lot of the tests that we try to localize and to get a positive diagnosis often come up negative. So a lot of times the veterinarians, when we're faced with these type of cases, have to base more of the clinical signs, the age, the presentation of the dog to determine whether or not we need to treat under the assumption that we have a mite infestation on the dog. And so between the two, probably the most substantial difference that, as fosters, that you guys want to be concerned about is that the Demodex one isn't one that we consider very contagious to other dogs or people. It's very specific to the individual, whereas the scabies mite is going to be one that can be spread to people or to cats. Now, it can't live its full life cycle on people or cats, but it still can spread to them and cause issue. And so that's why we try to be very aggressive with managing these types of diseases that pop up whenever we are suspicious of them.
So how would the treatment differ between the two?
So the two are going to be very similar, mostly because mites would kind of treat them all the same. The main difference that might occur would be how aggressive we have to go about it. A lot of times with mites, when you have dogs that come down with them, they're going to have secondary issues like secondary skin infections. They're going to be incredibly itchy, mostly because that skin has lost a lot of its health, and it's usually a good natural barrier to prevent basic bacteria that they encounter in the environment from really flourishing. And so with scabies, you might have to be a bit more aggressive, which you might see the doctor, after they see your foster dog, prescribing oral antibiotics or medicated shampoos. But both of these are, the main form of treatment for these are going to be usually an oral flea tick preventative. Just recently, the most common ones that we use are going to be NexGard or Bravecto. Previously, before this, the topical Revolution was used a lot, and then even before that, just the liquid ivermectin was used. So now, typically with the NexGard and Bravecto, the NexGard in particular is going to be one where you want to give a dose once a month for 2 consecutive months. And so once that's given, you really don't have to worry about anything all too much. They're very effective medications, and so usually we don't have to get worried about there being an extended period of time. The foster dog that you bring in isn't going to be contagious or a danger to the other critters in your household for those entire 2 months. Usually it's a couple of weeks in which we see that the contagious effects or the contagion concerns are going to be pretty limited.
So if I'm not the normal host for, let's say, a scabies mite or a sarcoptic mite,
Yep.
area or ways that I can prevent myself from getting it would just be washing up after handling and taking care of the main bedding areas that they are in the home, or even just containing them to a room or.
Yep. Yeah, basic isolation things are going to be great for these types of situations. It's even not all that necessary, actually. The sarcoptic mite, because it doesn't really reproduce or have its extended life cycle on anybody else besides the dog, when it's off and in the environment, it can only survive for about 36 hours. So generally, a lot of veterinarians, it's not as needed or recommended for having to really diligently clean the environment as much as you would, say, if you had a parvo case or if you had any other more contagious virus or bacteria.
Okay.
But they do recommend, if the dog managed to, lay in bedding or lay in your bed or anything like that, places where there's warmth, because that can extend the life cycle of these guys, make them a little bit more resistant to the environment, that you just want to clean those. Those would be the first and main places I would focus.
Okay. Now, I know that my dogs can get scabies or sarcoptic mange, but not Demodex. So other than just cleaning the bedding areas, another great option would just be to have my dogs treated with NexGard as a monthly preventative.
Absolutely.
If I have mange dogs with mange in my house.
Yeah, that would definitely be recommended. I mean, ideally, your dog, prior to taking in any foster, even if they have mange or not, would be to have them on a flea tick preventative, preferably NexGard, because of its effectiveness towards mites as well. Mostly because the last thing that you want is to have fleas, ticks, or mites being spread to your own dogs in the house. Because once those set in, sometimes it can be really tough to get rid of.
Sure. Okay, well, I think I answered all my questions I had, but if you guys think of anything else that you'd like to ask about mange, go ahead and comment below on the video, and we'll try and get those answered for you. But thank you for answering questions and taking care of everybody's foster pups, and I'll see you guys next time.